Hey guys, I'm in downtown Astoria, Oregon, and the number one thing I get told by Americans going up and down this beautiful coast is, you guys have free healthcare in Canada. No, we don't. We have socialized medicine, and you abide by our guidelines if you want to be taken care of or looked after or treated. We have socialized medicine. Go on our channel, look back 10 years, how we were forecasting the fall of Canadian healthcare, the fall and the bringing of socialized medicine that is brought through mandates and forcibly forcing people on things. Anyways, for the free healthcare, let me give you my explanation or my little story. The last time I actually sat down with a doctor was April 2019. Or sat down with the doctor, looked over a few things, did a few basic exams, checked me out, and set me on my way. April 2019. And then there's hospital shortages, and then hospital closures, and then from time to time the hospital in my small town closes from time to time, and if there's an emergency, you might have to go to another big city hours away to get help. Okay? And I still remember in 2019, March 2019, my wife was to give birth. So we went to our local hospital. And they wanted to send us, not to the hospital north of us that was 45 minutes, to a hospital 3.5 hours east of us. They wanted me to drive my wife in labor. So we finally negotiated another hospital that was closer, but it was an absolute disaster. Now, I haven't seen actually sat down with a doctor since April of 2019. Now, let's fast forward. I found a doctor. Finally, hallelujah, it took me years to find a doctor, a family doctor. I got my family doctor. Guess what? This was January 2025, a few months ago. Guess what the family doctor asked me? If my injections are up to date and am I taking all my injections and my flu injections. That was the first thing that came out of the doctor's mouth. So you see where I'm going with this free healthcare, folks? And we told people not to trust the science. We told people to watch it. We warned you before it even happened. But here we are, our free healthcare system, our free... I'm not knocking it because I might need it one day. There might be an emergency where I may need it, and I'm not knocking it. I'm just saying it's crumbling. It's falling apart. It was good in the 70s, 80s, and 90s. Let me tell you, it was real good back then. But now, it's actually turned to crap. A lot of doctors that they are recruiting doctors from all over the world because why? Because the local Canadian proper, a doctor, can't afford to live in their own cities. Go back to our videos from 2017, 2018, 2019, where this rare phenomena where doctors, police officers, firefighters, public servants living in Sydney, Australia, Auckland, New Zealand, London, England, Toronto, Ontario, Vancouver, BC, Los Angeles, San Francisco, couldn't afford to live in the same cities that they were born and raised and educated in, as doctors couldn't afford to live in their own areas. And that's why now Canada's trying to bring in doctors from all over the world. But when they arrive here and they realize that the average house, a decent house to raise a family, is going to start anywhere from $770 to like a couple of $1 million, right? Yeah, housing is now starting to take a slight correction. But it's nowhere near tied to what incomes are, right? And we kept saying on this channel for the last 15 years, incomes and wages need to be tied to real estate prices, not money laundering from China. And that's why we're in this mess we are today. Anyways, socialized medicine. Do you have a socialized medicine story from Canada? Has the hospital been good to you guys? Has it been has it been good, right? And if you go back to 2021, Mike in the Night, we had one of our callers that called in and sent us a picture of a patella that she hurt her knee and sliced her knee, and you can see her patella, the bone. She took a photo of it. She went to several hospitals, and because she didn't comply with the mandates, they wouldn't touch her. She was bleeding out. And she finally, I guess, negotiated with them and said, hey guys, like seriously, and threatening, I guess, with lawyers and stuff, that they actually took care of her, right? So you need to see, and it's just like how the Liberal Party will win the 2025 election. Mark Carney will win. Why? Because he'll gain the public sector vote. The public sector will vote for Mark Carney, right? Because they need to keep those six-figure income jobs for a house that's realistically worth 80 grand that they paid $1 million for. So I'm getting into other topics here. Socialized medicine. Is healthcare free in Canada? Let me know in the comments below. I'd like to know what you guys think. Mike Martins here in Astoria, Oregon. I have spoken.